Matrons office.
Take some deep breaths for me.
I think it's important to note that the advice and information given to me by the community matrons has extended my life by a considerable amount.
The Community Matron Service offers an intensive and personalised care to patients living either at home or in the care home environment. It also helps to reduce unplanned admissions to hospital and helps with early discharge where possible. And finally, the service aims to reduce the number of patients accessing unscheduled care and to empower self-care.
I'll tell you about this patient. This is a gentleman who is... Well, if a patient's got to the stage in their treatment where the possibility is of going home, then the community matron would come in and see the patient along with the other professionals, and if they feel that patient could be supported at home, they will do everything they could do to make sure that patient could be discharged earlier in order to receive that treatment at home. This service is making a huge difference because these highly complex patients do not benefit from prolonged stays in hospital, either psychologically or emotionally.
Well, thank you very much for coming this afternoon. What I wanted to talk to you about was whether... The service was created in October 2008 as a result of a national directive. The community matrons support and manage patients over the age of 18 who have long-term chronic health conditions. Many of them have several conditions which need to be stabilised, monitored and treated. The service supports patients with chronic respiratory conditions, heart failure and diabetes, and patients with neurological conditions with the support of our specialist nursing colleagues. It's aimed at patients who've either been admitted to hospital or have accessed the out-of-hours service twice or more in the last year, and patients must be registered with a GP.
There's a big drive by the government, by the Department of Health, to move care closer to home. That's something we would strongly support. It's good for the patients, it's good for us, and the community matron service allows us to deliver on that. Our matrons provide a wide variety of diagnostic and medical services. They're a great asset in supporting the GPs in the day-to-day work, avoiding the patients having to come down to surgery or us visiting them at home on regular occasions. It saves them a long trip to the hospital. We can do our assessments when we need to do them, and we can go out and visit, but the matrons will tell us, or their team will tell us, when we need to be doing that.
The service covers the eastern and coastal Kent area. Patients are referred from many sources, including GP practices, social services, acute trusts or self-referral, and it operates 7 days a week, including an out-of-hours service.
OK, John, shall we start off with weighing you first?
When a new patient is referred to the service, the community matrons will undertake an individualised care plan based on an assessment and physical examination of the patient. This is to ensure that they receive optimum therapy.
I had a number of visits to hospital, and the community matrons really pursued me in an effort to make my visits to hospital a little less frequent.
I was really quite surprised when this telephone call came from the community matron, and she would like to come and see him to give him support and to find out if there was anything that she could do to help us.
The community matrons carry out a very thorough examination and give me extremely good advice in a very short space of time and in a very informal manner, which would otherwise mean a visit to the doctors.
One significant benefit of the community matron service is that it allows patients to stay at home and to have rapid access to treatment should their condition change or deteriorate.
It is really important that community matrons and care managers work very closely together. The care manager can bring the social care element to the individual care plan. They can provide day care, domiciliary care, residential or nursing care, and now even extra care sheltered housing. It is really good that social services and NHS community services are working together seamlessly on telehealth and telecare for the benefit of our patients.
Please take your blood pressure.
Technology plays an important part in our service. Telehealth allows the community matrons to monitor a patient's vital signs via equipment placed in their own home, and its use has been a key element to this service. The patient is supplied with a computer, and all that is needed is a telephone line.
Lillian is an 88-year-old lady looked after by the community matron team. She's also using the telehealth system at home, and she feels very reassured that we are monitoring her.
I've got on with it very well indeed. I know exactly what to do. I do it every morning. I have to take my blood pressure, then I have to take my pulse, and then I have to take the blood from my finger for the sugar. And I think it's very clever. And then the matrons have their machine that goes through to their office. I think it's a very good thing because it stops the matrons from coming every day, and it gives them some idea with their machine how I am. And I think it's wonderful.
Our patients have managed the new technology remarkably well. Obviously it's not suitable for everyone, but some of our older patients are not as technophobic as you might think.
We closely monitor these patients so that we can avert crisis. Hopefully their longevity and their quality of life is improved because of the service.
Lillian, do you mind if I have a listen to your chest this morning?
No, certainly, darling.
Patient care within the home is delivered by a range of staff, including community matrons and support workers, along with dietitians, speech and language therapists and occupational therapists.
The nursing staff here provide all the care on a day-to-day basis. My aim is to come in and provide support and recommendations at any level. How are those legs doing?
It's important that we work closely with the staff in the independent care homes to ensure that the patients receive the same benefits from the service as those patients who live in their own homes. The service is going from strength to strength and has been very successful so far, and feedback from patients has been incredibly positive.
You know, these matrons that come to see me to make sure that I'm in good health and that are wonderful people. I don't know what I'd be without them. I think I'd have to end up in hospital if I didn't have their help. And I appreciate them very much.
Hello, Community Matrons Office.
The team that I've got are fantastic. They all work together. We're striving for the best outcomes, and we really feel that we are making a difference. It is inspiring to see patients in control of their lives. So they have our service from the beginning, and they know that even though their long-term condition is life-limiting, they are supported with that.
I think had I not heeded the advice given to me by the community matrons, then possibly I might not be here today.
From my point of view, I'm delighted that healthcare professionals across eastern and coastal Kent are increasingly seeing the benefits of the community matrons team. Our common aim is to continuously improve the service for patients and to bring care close to home.
They come whenever we call. If there's an emergency, touch wood, there hasn't been any yet, but we know they're there.